When we talk about irregular migration, we're referring to people actually who become undocumented for various reasons. In many regions of the world, entering irregularly is not the most common way of being undocumented. The most common way is actually entering a country regularly and then becoming undocumented afterwards. Their work permit might have expired and their employer did not renew it, did not wish to renew it. They might have come on a spouse-dependent visa and the relationship with the spouse breaks down due to violence. This is also the case that many women experience, also when it concerns a relationship with the employer that also breaks down because of violence. And so the individual then loses the residence permit, which is tied to the individual, whether it's the spouse or the employer. A child can be born to undocumented parents and then become undocumented themselves. One of the most common issues is the fact that they are undocumented means that they cannot safely access services that they may be entitled to. The fear of being deported, the fear of the status being communicated to the immigration authorities is what prevents many undocumented migrants from accessing health care, from children and being registered from school, undocumented workers who experience exploitation in the workplace or abuse by their employers may fear going to the labor inspectorate in the country where they're working, or they may not be able to register with a trade union. What's been interesting with COVID is that I think we've seen across the board that people who already were living in a very fragile situation in society had their situation compounded. In general, undocumented were exempt from many of the things that helped us and people in general during the pandemic to try to recover if work could not be done because of the pandemic. But COVID has also shown that societies relied a lot on essential workers or so-called essential workers, and many of them are undocumented. So we saw that essential workers during a lot of the COVID pandemic have been forced to work in conditions where they have not been protected. They are at high risk of actually being contaminated by COVID. And this, in a sense, has created an additional set of vulnerabilities for people who were already suffering in the workplace prior to COVID because of having a regular status. I think it would be useful to also look at intersectional approaches to irregular migration. And once they're undocumented, what are different levels of discrimination they might be facing for different reasons, because of their gender, because of their age, because of their sexual orientation, because they might have a disability, because they might be suffering from racial discrimination. All of these things can be intersecting with each other. And so it's really important when we look at people who are undocumented and migrants in general to have an intersectional approach, which then also allows us to go beyond migration policy. Civil society hopes that we can see some bold moves from governments in how we recover better from COVID and from the pandemic. I think one of the issues has been regular pathways for migration. Look at regular ways for people to migrate that involve decent work, that involve family unity and family reunification, that enable people to have a human rights approach during the migration process and during the settlement process as regular migrants. Civil society is also looking to see more objective and research-based discussion on regularization. Another area that civil society is very keen to see develop are the situation of firewalls. So how we can ensure at the national level, at the regional level, at the local level, that undocumented migrants can safely access healthcare, education, fair working conditions, that they can access the justice system safely without having their personal data transmitted to the immigration authorities. And that's the whole concept of firewall. This is also an area where civil society has already been working with different levels of government, especially local government, and where this is an area where there could be more partnerships, not only amongst civil society and government, but also different professional groups, such as health professionals, labor inspectors, education authorities. Undocumented migrants do have human rights. This was reiterated by the Global Compact on Migration. The policy failures that have created irregular migration need to be addressed, and a lot of this is centered around how labor migration is currently structured, as well as family reunification and other ways. We need to have a much more in-depth perspective in looking at what is causing people to become undocumented and try to find the appropriate remedies, including regularization.